Good morning, everyone, and welcome. My name is Heather McPherson, and I'm the President and CEO here at Women's College Hospital. I would like to begin by acknowledging that the land we are meeting on is the traditional territory of many nations, including the Mississaugas of the Credit, the Anishinaabe, the Chippewa, the Haudenosaunee, and the Wendat peoples, and is now home to many diverse First Nations, Inuit, and Métis peoples. We also acknowledge that Toronto is covered by Treaty 13 with the Mississaugas of the Credit. I would like to extend a warm welcome to the Honourable Sylvia Jones, Deputy Premier of Ontario, Minister of Health, the Honourable Peter Bethlenfalvy, Minister of Finance, and all of our distinguished guests joining us here today. It is fitting that we are gathered here today as Breast Cancer Awareness Month comes to a close. This month is always a valuable reminder of the importance of understanding the risk factors associated with breast cancer and how to minimize it. It is estimated that about 1 in 8 Canadian women will develop breast cancer during their lifetime, and on average, 78 Canadian women will be diagnosed with breast cancer every day. Fortunately, the 5-year survival rate is high due to both improvements in treatment and early detection with breast cancer screening. We know that regular, proactive screening is the best way we can detect breast cancer at its earliest stage to prevent advanced disease and hopefully save more lives. Women's has been a long-standing leader in breast cancer prevention and screening. In fact, more than 75 years ago, we opened the first cancer detection clinic for women. We were among the pioneers of early breast cancer prevention and intervention. And to this day, we are working to ensure every woman can access the highest standard of care in prevention, diagnosis, treatment, and survivorship of women's cancers. This includes building meaningful community partnerships to support screening specifically for Black and Indigenous women, who historically have been underscreened for breast cancer, leading to worse health outcomes. Looking ahead, we are committed to helping provide our communities with equitable access to early detection tools to reduce breast cancer risk. I would now like to invite the Honourable Minister Sylvia Jones to the podium. Minister Jones has a long-standing record of advocating for new ways to make Ontarians healthy. Thank you.
Thank you very much, Heather, and welcome. It is indeed a pleasure to be back here at Women's College, and good morning. I am really excited about today's announcement and thrilled that I'm able to be joined by my colleagues, of course, Minister Bethlenfalvy, Minister Williams, MPP Kusindorf-Mabasha, and, of course, my two parliamentary assistants, MPP Dawn Gallagher-Murphy and Robin Martin. This incredible facility has been a leader in world-class healthcare for over 100 years. And on behalf of Premier Ford and our entire government, I want to thank the entire team at Women's College for what you do to deliver convenient and connected care to Ontarians each and every day. I also want to thank Sherry Wilcox for joining us today and being prepared and willing to share your story with us. Under the leadership of Premier Ford, our government has been making record investments in healthcare. Through our Your Health plan, your government is taking innovative and bold action to build a more connected and convenient healthcare system by growing our healthcare workforce, reducing wait times, and expanding access to key services to improve the health outcomes for all Ontarians at every stage of life. And today, we are taking another important step to ensure Ontarians can access the care they need when they need it. I am pleased to announce that our government is lowering the eligibility age for publicly funded mammograms from 50 to include those aged 40 to 49. This change, of course, will allow for up to an additional 1 million Ontarians to self-refer for a mammogram if they decide screening is right for them. Nearly 12,000 Ontarians are diagnosed with breast cancer each and every year. We know early detection through regular screening with mammograms can save lives, detecting breast cancer before it has the chance to spread. And with this historic expansion, more mammograms will be performed each and every year, ensuring breast cancer is caught earlier and treated sooner. Those eligible are encouraged to have a conversation with their healthcare provider to discuss their risk factors, family history, and benefits of breast screening, and determine what is right for them. Our government continues to take bold action to strengthen our healthcare system, to resume the work that began prior to the pandemic to build a healthcare system that is both responsive and evolving to meet the needs Ontarians can need and expect to connect more people to care closer to home. I also want to thank our healthcare partners like Dr. Jacobs and the entire Ontario Association of Radiologists who are here today. We are grateful for their partnership and advocacy, which made this exciting announcement possible today. And of course, to Women's College Hospital for your leadership and for hosting us today. It's now my honor to pass it over to Minister Bethlenfalvy. Thank you. Stay on.
Well, thank you, Minister Jones, and it's great to be here. I've come a long way from the Frost Building, which is right across the street, but it's such an honor to be here and participate in this very exciting announcement during Breast Cancer Awareness Month, alongside my great partner, Minister Jones, who sits beside me in the House, and we don't get too many questions, so we spend a lot of time talking together. Minister Williams, great to see you. What a great champion for women. And the fantastic parliamentary assistants to the Minister of Health, Dawn Gallagher-Murphy, and of course Robin Martin and Natalia Kusendova-Bashta. Grateful and honored to be here with you today. And you know, folks, they're all champions for what we're announcing today, because many have been affected in their lives by breast cancer. This devastating diagnosis causes untold physical and emotional burden and significant pressure on our healthcare resources. Nous avons tous, d'une manière ou d'une autre, été touchés par le cancer du sein. Quand on le diagnostic dévastateur, il donne lieu à un indescriptible fardeau physique et affectif, en plus d'exercer des pressions considérables sur nos ressources en santé. Our government gets it, and that's why we're expanding the eligibility for breast cancer screening. So that's starting, as was mentioned by Minister Jones, starting in fall of 2024. People aged 40 to 49 will be able to self-refer for a mammogram. And you know, all of us have a mother. You know, every single person on this planet has a mother, and this is such an important day for all the mothers and the daughters, sisters in this world. So I'm very proud to be with my colleagues here today making this announcement. Without the need for a referral from a family doctor or other primary care provider, this is game-changing. Make no mistake, this is a measure that will save lives and make the healthcare system stronger. This is just another way our government is building a more connected and convenient healthcare system for the people of Ontario. So through that plan, pharmacists can now prescribe treatment for 19 common minor ailments. The backlog for surgeries has been reduced by more than 25,000 from the peak in March 2022. And I want to congratulate you again at the Women's College here, who do remarkable work helping people's lives. The people of Ontario can have confidence that we will continue to provide better services for you and your family. This Thursday, I will release the 2023 Fall Economic Statement to provide an update on our plan for building a strong Ontario. Jeudi, je déposerai l'exposé économique de l'automne 2023, qui fera le point sur notre plan pour bâtir un Ontario fort. This update will continue with our government's targeted, responsible approach, so we have the flexibility needed to get through this economic uncertainty while laying a strong foundation fiscally for future generations. We know that the economic uncertainty that surrounds us is a challenging time for many, as well as geopolitical challenges right around the planet. But we should all be confident in Ontario's economy, its workers, and its people. And we have seen what the people of Ontario can overcome when we work together. Together we can build a strong Ontario, and with that, it's now my distinct pleasure and honor to welcome Sherry Wilcox, a champion for patients, to the podium. Sherry, please join us here today.
Thank you, Minister Jones. My name is Sherry Wilcox, and I am a woman in my 40s. I'm also a wife, a mother to 3 beautiful daughters, a lawyer, and most recently a breast cancer patient. I was diagnosed last year with breast cancer at the age of 44. I recall asking about a mammogram when I turned 40, but I was told at the time that I wasn't eligible and that screening didn't start until 50. So, like many, I parked the topic until, of course, I found a lump in my right breast. It was then that I was faced with the challenge of being a breast cancer patient, which demanded my unwavering attention, resilience, and the support of my family, friends, and employer. Earlier this year, alongside the Ontario Association of Radiologists and Dr. David Jacobs, we were welcomed into Minister Jones's office to talk about this very important issue. I cannot thank you enough, Minister, from the very bottom of my heart, for listening and for prioritizing women's health by announcing Ontario will be lowering the breast cancer screening age from 50 to 40. There couldn't be a better way to conclude Breast Cancer Awareness Month than to witness such a meaningful and impactful announcement. Breast cancer has changed my life in ways I never could have imagined. But beyond the negative physical, emotional, and psychological effects of this disease, I have become a part of a community of strong, remarkable women. To all of the women who are breast cancer survivors and patients, and to the families of those who have passed, this announcement is a recognition of what you have endured. While it may be too late for us, this is an incredible opportunity for others going forward that hopefully will not have to bear the negative consequences of a later diagnosis. If you are a woman in your 40s, go, please, and get a mammogram. And for everyone else, tell your daughters, sisters, mothers, coworkers to get screened. Early detection of breast cancer results in less aggressive treatment and reduced mortality rates. Early detection saves lives. Thank you again, ministers, for making this important announcement, and to the Ontario government for prioritizing the well-being of women in Ontario. Thank you.
I can think of no better advocate. Thank you, Sherry.
There we go. The microphone clicked in. At the microphone, as a friendly reminder, it's 1 question, 1 follow-up. Please state your name and your outlet before your question.
Hi, good morning. It's Jessica Smith-Cross from the Trillium. We will be covering this announcement today, but we were also writing about the decision to reverse the municipal official plans. So my question is to Minister Jones in her capacity as Deputy Premier. When did you learn that the process used to make the changes to these plans was flawed?
So, as you know, when Minister Calandra took over the Municipal Affairs and Housing file, he has initiated and already made some very strategic, important announcements to make sure that processes going forward are followed, and that more importantly, he has been reviewing both official plans and, of course, the Greenbelt decision.
To follow up, Minister Calandra has told us that, in his opinion, there was a little bit too much involvement from individuals within the previous minister's office. Do you share his concerns about Minister Clark and what went on in his office?
What I will reiterate is, since Minister Calandra has taken over the Municipal Affairs and Housing file, he has not only proactively looked back at decisions that were made, but also made decisions going forward that will ensure the process is clear and consistent across Ontario. Thank you.